adults, it is a very good early intervention for dementia. It really quells anxiety and makes people able to socialize better. And if they're in a facility, it's very helpful for being able to adjust to staffing and the new environment that oftentimes is very upsetting to patients with dementia.
Hello, and welcome to Not Born Yesterday, a podcast dedicated to older adults and the challenges and joys of aging. I'm Miriam Goodman.
Not Born Yesterday is brought to you by Next Village SF, a local nonprofit providing older adults in the Northeast neighborhood of San Francisco with support to help age in place. I'm Lynn Winter-Gross.
Today on Not Born Yesterday, we're going to talk about health and an alternative way to treat some of the medical conditions of aging. Perhaps what we've been doing already to calm our anxieties or deal with sleepless nights or eliminate our back or leg pains just hasn't worked. Adding exercise, meditation, or prescription medications also may have helped, but not enough. There is an alternative that some of our listeners may have tried or just want to know more about. It is medical marijuana, and depending on where you live, medically approved. According to a recent study in the Journal of American Medical Association, cannabis use among adults aged 65 and older in the U.S. has been steadily increasing. This is due to a decrease in the stigma associated with cannabis use and an increased interest in the benefits. In a recent poll, 94% of Americans voiced support for legal access to medical marijuana, and most states have approved some form of legal access. Most common uses among adults are for pain, anxiety, and insomnia.
We're not here to promote anything, but just to give our listeners some new information. Our guest today is Dr. Lori Volin, a board-certified physician in clinical preventive medicine and founder of National Healing MD. Since 2000, Dr. Volin has helped over 13,000 patients develop personalized treatment plans to address their medical needs through the use of safe and effective medical marijuana. Her work with older adults is our focus today.
Dr. Volin, welcome to Not Born Yesterday.
Thank you for having me.
So we know you've been working with medicinal marijuana for many years. How did you get into this specialty?
I'm a physician and I was trained in California, but then I left the state and came back in 2000 to be a scholar at University of California, Berkeley. And I also wanted to maintain my clinical practice, so I covered for their doctors. And that is when patients began telling me that they didn't need refills on their prescriptions, and a few of them began to tell me why. And the reason was because they had found an alternative that was equally as effective with less side effects. And let me emphasize, less side effects. And that was medical marijuana. So it behooved me to look into its effectiveness and safety. And as time went by, I found that it was, for many patients, more effective with less side effects. And so now that is the only kind of medicine that I am prescribing.
And would you, just for our people who don't know, could you tell us the difference between recreational marijuana of the past and today's medical marijuana? And then tell us the difference between THC and CBD.
So recreational marijuana, the goal is for an altered state of consciousness. That is what people are trying to obtain. And medicinal is for relief of symptoms, most frequently pain, anxiety, insomnia, and in other cases, less frequently, but equally as effective, depression, dementia, and post-traumatic stress syndrome. And oftentimes it's related to the dose that gives you the medicinal effect, because you don't need to be high in order to get the symptom relief from recreational marijuana. THC is the component of marijuana that is, quote, psychoactive, and it can result in the medicinal effects if taken at the right dose, but then the unpleasant effects for most older adults, which is feeling out of control or dysphoric or high. And CBD, unlike THC, does not have that type of psychoactivity, but it also doesn't have all of the medicinal effects that THC has, but many older adults are drawn to it because of its lack of psychoactivity. Both of them are what are called phytocannabinoids, which means that they're cannabinoids of the cannabis plant.
So medicinal marijuana, unless you're prescribed properly, could make you high?
Yes, of course, because the component in it, THC, if taken at an inappropriately high dose, the side effect is getting high. It's all about the dose.
So are older adults hesitant to ask for these?
Well, certainly not the older adults that I see, but many older adults are afraid of cannabis because of the psychoactivity and don't pursue it because they assume that they have to get high in order to get the medicinal effects, and that is not the case.
I assume it's rare that internists and gerontologists prescribe medicinal marijuana today. So do you recommend that people talk to their other doctors before taking cannabis or before trying any of the things to find out how it will react with what other medications they're currently taking?
I always recommend that patients be open with their physicians. Also, because if they're already using cannabis, it's a way to inform physicians about the benefits that patients are accruing because of cannabis. That's how I learned of cannabis's effectiveness.
So how do you know how cannabis is going to interact with medical marijuana is going to interact with the other prescriptions that the doctor's already prescribed if the doctor says no?
Despite a lot of misinformation, there is very, very little to be concerned about with regard to interactions with other medications. The classic one is Coumadin or warfarin, which is a blood thinning medication, which is being prescribed less and less. If you're on medicinal doses of marijuana, there's really no significant interactions. The other concern is high dose anti-epileptics, which is usually relevant in children, not in adults. And once again, it has to be beyond medicinal doses in order to actually interact with those medications.
So if somebody walks into one of these fancy medical marijuana shops and they see all kinds of gummies and different colors and different packaging, and the people working there aren't really familiar with older people coming in, how do you know what to ask for?
So I would never go to a dispensary without knowing what you want. I think that's one of the biggest mistakes. I think you need to go to a dispensary knowing what you want. And there are so many decision-making points that you need to spend some time making those decisions in advance of going to the dispensary. First of all, what cannabinoid do you want to focus on? The two that are now of interest are CBD and THC. And if you're new to this, then starting with CBD is probably the easiest thing to do. It's safer than THC. Then how do you want to get it into your body? Do you want to take it under your tongue? Do you want to use an edible? Do you want to inhale? Do you want to do topical usage? And then once you've made that decision, what dose do you want? What is your starting dose? And then you go into a dispensary and say, I want a sublingual medication with a starting dose of X number of milligrams of CBD or X number of milligrams of THC. And then you see if the bud tender can actually guide you to a product with that beginning dose. You do not want to go into a dispensary not knowing how you want to get the medicine into your body, what cannabinoid you want to start with, and what your starting dose is. You have to know those before you walk in.
And where do you get that information?
Well, the introductory guidance that I provide free on my website is available on my website under the resource section, www.naturallyhealingmd.com. Under the resource section, there's an introductory guide to patients who are new to marijuana, and it goes through all of the different ways in which you can get it into your body, as well as the starting dose.
So here's a weird question, but why haven't the big pharmaceutical companies joined this game, and why aren't they producing products like this?
Well, because they can't patent marijuana. Marijuana is a plant, and you can't patent a plant. The pharmaceutical companies are working on synthetic products that they manufacture chemically in their labs. For example, they developed something called Marinol in the 1980s, which is pure THC. But anyone that's tried pure THC who knows what the effects of using the plant are will never use synthetic THC again, because the single molecule synthetic equivalent does not give you the same benefits of the plant. The plant has all these other ingredients in it that slightly modulate its effectiveness and make it much more tolerable with fewer side effects and much more effective.
So if you're using some medical marijuana and you say it might not interfere with your regular medications, are there any risks?
Oh, sure. I mean, older adults do need to be careful, and more careful than, your invincible 18 or 21-year-old. There are more underlying diseases that older adults have that could present a risk. For example, and most particularly cardiac disease. So if an older adult has heart disease, they want to stay away from inhaled marijuana, and they do want to check with their cardiologist if they're going to use THC. So number one, is it safe given your underlying disease? Number two, it's always worth asking your physician if there's any concern about your medications. Number three, you want to make sure if you're going to use THC as an older adult, that you take precautions that you don't drive for 6 hours after taking any THC, and that you take fall precautions. Those are standard advisories also for pharmaceuticals that alter your, that are psychoactive. So the other thing I would recommend to older adults is if you are using THC, use it with a dose that's appropriate to start with and go up slowly, and preferably use it with someone else, in the house, so that you're not alone, so that if you do have any kind of fear in response to it, you have someone there who can reassure you.
Can you give us some examples of what conditions medical marijuana has helped the most, and somewhere it is risky besides heart disease?
Yeah. So I see patients who get tremendous relief with pain, chronic pain like rheumatoid arthritis, the pain associated with large joints like hips and knees, with patients who are post-op, who have gotten a new knee or a new hip, who are on opiates and want to taper off as quickly as possible. So pain is one of the most effective applications of cannabis. So is anxiety. So patients that have generalized anxiety disorder or occasional anxiety due to the realities of modern day living, cannabis is extraordinarily effective. And in that case, high dose CBD can be used with very little THC. So there's very little psychoactive component. So that is one of its most effective applications. In terms of insomnia, there are patients that have difficulty sleeping because of pain and anxiety. In those patients, it's extremely effective. If the insomnia is due to another reason, postmenopausal insomnia or long-standing insomnia, it's not as effective as it is when the underlying cause is anxiety or pain. I would say that the effectiveness rate is about 50%. And then with older adults, it is a very good early intervention for dementia, extremely good. It really quells anxiety and makes people able to socialize better. And if they're in a facility, it's very helpful for being able to adjust to staffing and the new environment that oftentimes is very upsetting to patients with dementia.
So if someone decides they want to try it and their doctor is not really enthusiastic about it or probably doesn't know much about it, and they walk into a store, are they likely to get something that's dangerous if the people working there don't really understand what's happening with older people?
Well, here's the problem in California. The dispensaries here are no longer medicinally oriented in many, many, many respects. The products that are on the shelves are geared towards recreational users, and those products are extraordinarily high in THC. And yes, if those are the products that are geared towards recreational users are the ones that they are starting on, that is dangerous because you can end up with far more THC, and too much THC results in, at the very least, anxiety, and then it goes up from there in terms of its unpleasant side effects.
So someone listening who may have smoked grass 50 years ago, let's say, they know there's an immediate response. They know right away if it's working. How about with these products? Does somebody have to wait after taking it several days, several weeks, or are they going to find an immediate response as well?
If you start low, you will not get an immediate response. What you will avoid is the negative side effects of taking too much. So by starting low in the beginning, you won't get symptomatic relief. But then as you gradually increase the dose, say by 0.5 milligram per day, you'll eventually reach what I call your sweet spot. And your sweet spot is the dose that helps alleviate the symptom that has been problematic without the side effects. How long that takes really depends on what that sweet spot is. If your sweet spot for THC, for example, is 2.5 milligrams, and you start out at 0.5 milligrams, it will probably take you several days to get up to your sweet spot. If your sweet spot happens to be in the 15 milligram range, then it could take you several weeks to get up to your sweet spot. So it all depends on the individual, and there's no way to predict. It's not a question of how much do you weigh, how old you are. It's about the genetics of your receptors.
Oh, great. Well, thank you so much for sharing all this interesting and important information. Our guest today was Dr. Lori Vollen.
Thank you.
Today on News You Can Use, we're talking about women and their financial future. Many older women are concerned about outliving their retirement resources, yet too many are ignoring the opportunities to do something about it now. And even the ones who think they know what their assets are have failed to do the math and calculate expected and unexpected expenses in retirement. According to the MetLife study of women retirement and the extra long life, women face different risks than men when it comes to planning for a secure retirement. More than half the women surveyed say they're concerned about outliving their funds, and 61% said they didn't think they had sufficient savings to last their anticipated lifetime.
So what's a woman to do? Take responsibility. Has your spouse or partner done all the financial planning up until now? Women who are conscientious about their own finances can reduce the specific risks of being female. They should seek gender-specific advice and information to make sure they have input in financial decisions made for the couple. If the spouse or partner has been reluctant to share in the planning until now, women should insist on equal involvement in shared information and calculations from now on. A joint strategy that serves the interest of both parties should be the goal. Have a plan B. Think about various what-ifs, but don't obsess about them. Always plan for expenses like long-term care and health costs related to women's longer life expectancy. Consider whether or not to cash out of health or insurance policies and understand what happens if it's done prematurely. Know what your Social Security benefits are and what they will be if you outlive your spouse or your partner.
Do the math. Knowing your needs and resources is the key to planning and saving. Think about whether what you have now will last your expected gender-specific lifetime. Don't put it off. Financial planning is not easy or necessarily pleasant, but timely action is the best defense. Start planning now and have a few different scenarios. Make necessary adjustments if you don't like what you discover. Remember, your later life and financial health depends on it.
And that's our podcast for today. Our thanks to guest Dr. Lori Volin. You can learn more about Next Village SF at their website, nextvillagesf.org. Our theme music is from Hook Sounds, and Jason Dahlstadt is our engineer. And thank you for listening. We'd love to hear what you would like us to discover and discuss. Please contact us at notbornyesterdaypodcast.org. Be well, stay strong, and remember, you weren't born yesterday. I'm Lynn Winter Gross.
And I'm Miriam Goodman.